Even though I work in the medical field, I neglected my own health for a few years. In 2021, I had a breast reduction surgery. Tissue obtained revealed no malignancies. Later that year, my doctor that I work with wanted me to go and have a new mammogram. I thought there's no family history, but I went. Mammograms in the past required me to do additional testing because I have dense and fibrocystic tissue. My mammogram was abnormal and I had to do an ultrasound and then biopsy. The day after my biopsy, my doctor called me into her office and she told me that I had invasive ductal carcinoma. It turns out that my last mammogram was almost 5 years before that. After thinking there was no family history, I found a distant cousin who did have a history of breast cancer. She had taken hormones and I did not. So then I saw my breast surgeon. She did another ultrasound and said my lymph system was congested. I feared that it had spread to my lymph nodes. She said I had a choice between a total mastectomy or a lumpectomy with partial irradiation. And I chose the lumpectomy with radiation. So lab testing, MRI, and chest x-ray were done prior to surgery. And I arrived early at the surgery center to have a guide wire inserted into my breast for them to definitely find the cancer so that they could remove it properly. So my surgeon then inserted dye into my vein to light up the lymph nodes to check to see if the cancer had spread. 5 lymph nodes were removed for biopsy. Removal of these can cause lymphedema on that side of the body. After my tumor was analyzed, my cancer was contained to the breast and I didn't need chemotherapy. It was estrogen and progesterone receptor positive, but negative for HER2. The tumor measured 2.1 by 1.9 centimeters. An analysis of my tumor showed breast cancer was not a risk for me. A month later, the doctor inserted a catheter into my breast for me to receive radiation. The catheter chamber directed the radiation to the spot where the cancer had been. My heart and lungs were more protected by using this method. The procedure was done in office with lidocaine and a Valium. That was more difficult than surgery or 10 radiation treatments. The doctor says I'm cancer-free, although I prefer the term no evidence of disease. A week later, I finished treatment and rang the bell. After receiving my gene testing, my medical oncologist said my recurrence score is 11. She told me that if I took tamoxifen, it's a medicine that is used to prevent breast cancer, and if I took that for 5 years, my recurrence risk at 9 years is 3%. I opted to take tamoxifen and start the medicine almost 3.5 years ago. I was doing mammograms twice a year, but now only once per year. I have had MRI and bone density testing this year, which was normal. My surgeon recommended a compression stocking for my left arm, as lymph node removal can cause swelling in that area. Some have to wear stockings frequently. Luckily, I only have occasional swelling and use the stocking only for long driving trips and for flights. My entire journey for cancer was 77 days beginning to end. So I do encourage you, get your mammograms, your prostate screenings, and your colonoscopy.